Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Evey Andersen, a board-certified family nurse practitioner, certified sports nutritionist, homeopath, anti-aging expert, and overall functional and integrative medicine powerhouse. Through her clinic, Green Medicine of Wisconsin, which is based out of Oshkosh, Wisconsin, Evey helps patients navigate complex chronic conditions by blending functional medicine, nutrition, circadian biology, and homeopathy. Her clinic has a special interest in Lyme disease, or Lyme complex, as she calls it, and since this is a hot topic during the springtime in Wisconsin, we're excited to fill 2 of our 4 episodes with some incredibly empowering discussions around Lyme symptoms, treatment, and prevention, all through a functional medicine lens. Our final 2 episodes together are filled with topics that Evey has extensive professional and personal experience with, including circadian biology and how different types of light, like sunlight, red or blue light, impacts us and our kids, as well as how homeopathy can be a natural way to support first aid needs and short or long-term disease. In her personal life, Evey enjoys yoga, spending time in the sauna, and enjoying nature with her husband, daughter, and their 2 sweet dogs. We can't wait for you to meet Evey, so let's jump in.
Hey everybody, welcome to the Motherhood Alliance podcast. We are super excited to have Evey here with us today from Green Medicine. We are going to be talking a lot about Lyme disease, and we're going to talk about why it's not Lyme's disease, by the way. But before we get started, we always like to ask our guests about some fun facts about themselves, kind of get to know you a little bit. So I have here that you actually were a competitive figure skater growing up. Can you tell us about that?
Yeah. So in first grade, my best friend, her mom taught skating lessons. And one day she goes, "You want to come skate with me?" And I was like, "Yeah, for sure." And I just was obsessed after that and took lessons myself. Pretty quickly got involved with our local club. And then from there, you just kind of dive in.
Yeah,
and
now it's your life.
It truly was. And that's what I wanted to do with my life. I wanted to just skate for the rest of time. But, that's not how it transitions and transpires. But it was amazing. I still love it. I used to coach as well all the way through college. And so it was my favorite thing.
That's
still is one of my
cool.
favorite things. Yeah.
How often do you get out now?
Yeah.
Oh, gosh. I took my daughter for the first time 3 weeks ago. I think we went, and she loved it. So
How old is she?
2.5.
Oh,
so she's been asking
very
to go.
early. That's awesome.
Yeah. So I wanted to get her in lessons, but the place or the schools around here for learn to skate schools don't take anybody under 4. So it's like, I'll take her myself because I can do that.
You could teach her. You can do that. A little bit of experience.
Yeah. So it was good.
That's
and
awesome.
That would have been my first dream job.
That would be so cool. I know. I think a lot of people would feel that way about their sports and their passions, right? But, But speaking of jobs though, you have a pretty cool job right now anyway. So, you're into functional medicine. How did you get into that? And what led you specialize in particular Lyme disease?
Yeah. So, I suppose when the story goes way, way back to when I was 7, I actually got bit by a tick. And this is a story I tell a lot of my patients. Shortly after that, developed things like couldn't walk. I had a bullseye rash, which is uncommon, fevers in the middle of summer, and they told my mom I was making it up. So, of course, my mom's like, "Oh, no, you're not. She's not making it up," and pestered the pediatrician as one should. And 2 weeks later, she got a referral to Marshfield, and like, "Oh, yeah, this is Lyme," and I was treated appropriately. But you kind of have these ongoing things, having had that, where what I feel I did was gravitate towards this kind of healthy lifestyle where you feel better doing certain things and you feel worse doing others. So it's always been part of my life. Again, being an athlete, growing up skating, it was just kind of where I started. And my first go around through school was in health promotion and wellness. So doing a lot of what people now consider health coaching, but it was more for organizations or schools where you would create programming either for students or employees, lunch and learn type programs. But in 2008, those jobs were just eliminated from the budget. And I looked at the jobs I wanted and they wanted a nurse. And I'm like, yeah, I can do nursing. So I applied to one school, got in at UW-Madison, ended up going to school there for their nursing program and then applying to a residency and got into neurosurgery trauma for about 10 years. So that was an intense experience, about the furthest thing possible you could get from wellness.
Yeah.
But amazing in the sense of having that sense of what you can handle and know what you can't. You see where Western medicine does a really, really good job, and that's in trauma care. Mm-hmm. So I learned a lot, and I really did enjoy it, but I worked at night, the worst possible thing for wellness. And eventually wanted to do more of that preventive wellness care. And looking at what jobs I wanted, it was like, oh, you should do an NP. And I'm like, okay, fine. So I went back to school, did that. And then I ended up working at Aurora for a couple of years, but it's just been something that has been in my life where I have always approached patient care as I would want myself to be treated. And that's just a hard line for me, where I'm not going to recommend something if I'm not going to be the person doing it. So that got me to where I am. My husband's actually a pharmacist locally and met Dr. Green's wife as I was starting at Aurora, and probably just before, and he goes, this is what you want to do. You need to go hang out with him. I was like, okay, cool. So I immediately emailed him and promptly heard back about 6 months later. And he goes, yeah, come shadow. And I was like, well, owning the business myself now, I realize how emails get to be kind of the last thing on your list of the day.
Yeah.
So I get it. But I ended up shadowing there for about a year and a half. And little did I know he was interviewing for a replacement at that time. And so pretty much my days off from my other job, I would shadow with him. And I loved learning it. And I had a background in Lyme personally. So I knew kind of the idea and what the population was going to be like. And he had been integrative minded already in his practice at Aurora before he had left. So anyhow, eventually it was like my birthday weekend of 2017 or 2019. He's like, do you want a job? Do you want to work with me? I'm like, yeah, this is my dream job. Like, I come here for free. Yes, please. So I started there, and we officially changed ownership in 2023. So 22 to 23, but he's still our medical director, and I see him all the time, call him. So anyway, that's kind of the quick, long story.
So his clinic specialized in Lyme?
Yes.
Okay, and then that's how you kind of got into that industry specifically.
Correct. So he had already done a lot with Lyme, and looking back at my patient population when I was at the other hospital working in primary care clinic, I missed it a lot because it is so different. You see different presentations in patients that can be all across the board.
Yeah.
So it was already on my radar, and I know I still missed it. So yeah, but he had already had that established. Green Medicine officially opened in 2013. So it's been great.
Cool. And everybody calls it Lyme's disease. Mm-hmm. You actually call it Lyme complex, no S on the end of Lyme's. So why do you call it Lyme complex, as well as you also call it the invisible enemy? So break some of that down for us.
Yeah. So Lyme with an apostrophe S, that is incorrect. It's not a possessive. Lyme is actually a place in Connecticut. So that's where they first discovered the bacteria Borrelia burgdorferi, which is thought to be the pathogen behind these symptoms. It was actually in children. They found this collection of kids that had juvenile arthritis symptoms and were getting either steroids or hip replacements at that, just kind of in large numbers in this collection of areas. So they did some more investigating, and that's what they found. It was this bacteria. So when we think of Lyme complex, it's not saying it is a complex disease, in my opinion, but it's encompassing all of these other pathogens that can be also transmitted by ticks. You can certainly have a tick disease or Lyme complex, so to speak, one of these diseases or pathogens under this umbrella of that Lyme complex. So that's kind of how I explained it to patients and conceptualized that, where I don't think of them as co-infections, and that's kind of a debated topic between clinicians as well, as like one is more important or less important. And I don't think they're less or more important. I think they're just together. And that makes the collection of symptoms really challenging to kind of terse out. So Borrelia itself in the United States has 100 subspecies. And the traditional testing, say if you go in any of your local offices here, are going to be testing for just one.
Oh.
And the test that we do through IGeneX, which is based in California, is the gold standard as far as we have, but it only tests for 8. So worldwide, there's supposedly, and this is the last number I heard, was over 300 subspecies. So people travel, animals travel. I've seen European species in Amish patients who have never traveled outside of their small communities. So it's very interesting to see that.
Wow.
Whoa.
So and we'll be talking about testing more in depth in our next episode, as well as treatment and prevention. But just to stay high level here with the testing. So just to make sure I'm understanding you correctly, you're saying that there's over 300 subspecies, but even the gold standard test only tests for 8.
Currently, yeah.
So is this why it's called the invisible enemy? Is because people can have it even though they're testing negative?
Correct. There's a couple reasons for that. So you could have one of the subspecies that aren't detectable by our test. And it's not to say the test is bad. It's just the capability we have. And unfortunately, there's not a lot of research being done or interest in pursuing more comprehensive testing for that. The other aspect of calling it this invisible enemy is truly because it actually wears your own body's clothes, so to speak. So it presents as your cells as it goes throughout your body. It also hides, so it's a spirochete, so it drills in, kind of like a corkscrew shape, and hides along the cell wall. Dr. Green, when he was doing microbiology, he's had like 27 lives. He's so cool. But he watched this under dark field microscopy, where the spirochetes actually drill out of one red blood cell and drill into another, and they lie flat against the cell surface. You never see them.
Whoa.
Well, not only do they hide physically, but they also, again, with your immune recognition, your immune system trying to find pathogens and combat those. Well, I don't know if you've ever worked anywhere where you have an ID badge or have to badge in somewhere, but it's similar to that, where they have your ID badge. They look like you, they present like you. So as they're going through your immune system doesn't recognize that. They're like, oh, that's one of us. Don't attack it.
Yeah. So is this why that Lyme disease actually that's why it's misdiagnosed so much, is because it actually shows up as you.
Because your immune system can't recognize it, and it can't recognize it. It can't do anything about it.
So, but it's causing symptoms.
It is,
at the same time.
Yeah. So it's wild, isn't it?
It is so wild. So here's a question:
Sure.
how is it transmitted? Is it only through ticks? It is only through deer ticks? How does it get transmitted?
So transmission certainly can occur through vectors, biting insects. We had a young baby, actually, whose mom had Lyme, wanted her tested after, just to make sure there wasn't transmission from mother to child. The child did not test positive. And of course, the testing might not be accurate. But when that kid, I think was about 2, got kind of attacked by mosquitoes at a park, and then got a bullseye rash and subsequently had positive testing. So it's possible that any biting insect could transmit, which is kind of terrifying in Wisconsin. But, you do the best you can, and you work to mitigate some of those lifestyle factors that are really helpful in keeping your immune system strong. But it can be also certain tick-borne pathogens can be transmitted through blood transfusions. We have several patients that claim that is where they believe they got their condition, was after a surgical intervention, that they needed a blood transfusion. And not Borrelia itself, but other tick-borne illnesses, which is why we do not recommend any of our patients donate blood during active treatment. So those are the big ones. There is reasonable data coming out of Belgium. There's a study that was at the conference I was in 2023, I believe it was. I haven't seen the final publication of it, but they were researching children of moms that had either symptoms or tested positive. And the rate that they were seeing positive in the children was 89%. And the same with sexual transmission between partners. So
really?
So the hard part is, obviously everybody has their own experience. Like, they could be, especially in this endemic area, they can be out on their own. I mean, we have a lot of hunters, campers, people who fish, or just like to be outside,
right.
which we want you to do. So their exposure might already be high. It doesn't mean they're going to have symptoms. And so that's the other curious part is, so the sexual transmission, I'm a little bit less confident that that's an accurate percentage, but the mother to child is interesting.
So now that everybody's freaking out,
right. Yeah.
I just wanted to tell you guys, in our second episode about Lyme, we will be discussing prevention tips.
Yes, absolutely.
But let's circle into common symptoms. So I think everybody's heard the bullseye rash. What are some common symptoms? And then let's talk about some maybe uncommon symptoms that may be pointing to Lyme, but people wouldn't suspect it.
Sure thing. The biggest thing when I was going through my most recent school, this is a while ago now, but in my NP program, you had a paragraph which is 3 sentences long, talking about the hallmark symptoms: joint pain, fevers, malaise, like flu-like symptoms, along with this bullseye rash. The bullseye rash only occurs in about 17 to 30% of patients, depending on what research you're looking at. So you do have the vast majority of patients potentially with Lyme that never have that. I've seen things where somebody will go in with a tick bite, have a bullseye rash, they'll be started on a prescription or antibiotic, and then they'll do the testing immediately. Well, their body hasn't had enough time to even create any antibodies to make the testing positive, and then the clinician will call, stop the antibiotics, your testing was negative. So please don't do that. So just putting that caveat in there. If the bullseye rash is there, that's clinically diagnostic in those patients, unless they are very eager and want that testing on paper. I do not test unless they really, really want that, because that's a clinical diagnostic tool. CDC's own admission, I don't know why I had a paper on this, but they said that the way you diagnose is based on signs and symptoms and clinical history of exposure, which is a lot of people. The symptoms, I guess, that would be less common can be things that you wouldn't necessarily consider as classic Lyme, which is a lot of neuropsychiatric symptoms, a lot of anxiety, depression, insomnia, cyclical, either oscillating between sleeping too much, not sleeping enough, depression. When I was leaving Aurora to go to Green Medicine, I had tested 2 patients per their request who were both bipolar diagnosis and both were Lyme positive. So at that point, it was like I was leaving. I couldn't, start treatment, but it was curious. So you wonder, these mental health symptoms could certainly be, joint pain. There's a lot of people with GI cyclical vomiting that can present that in that manner, but it's actually Lyme.
And when you're saying cyclical, so you mentioned this for even depression, for that as well. What would the cycle look like? Is it like you're fine for a couple weeks and then all of a sudden you have a random vomiting experience and then you're fine again for a couple weeks?
And seemingly there's no provocation, there's no rhyme or reason other than
no routine or whatever.
I ate ice cream this day and didn't this day and I got sick both times. So people look for those types of things. I will see a lot of scans on brain MRI. Sometimes they'll see some lesions that the differential is either pseudotumors, migraines, or Lyme. So those are things to consider. So if anybody ever has like a T2 flare on their MRI, that's something I certainly consider Lyme in that diagnosis, which is interesting.
Wow.
So to back up a little bit, this is super overwhelming, I think, for a lot of people because in today's age, a lot of people have they're not the bill of health. They have something going on, whether it's mental health challenges like anxiety and depression, or they're getting some, my joints are kind of achy, or I just feel really old, even though I'm only in my 30s, or just these different things. So a lot of people are dealing with symptoms in one way or another of something is not quite right. It may not be Lyme, but something's not quite right. And then at the same time, testing for Lyme is only testing for a small amount. So is there a huge population that's walking around with Lyme? How do you start as a clinician? How do you start to figure out what they have? Because it could be gut health related things. It could be hormonal things. It could be, like you said, a microtumor. It could be Lyme. Where do you start to figure out what's actually the cause of their symptoms?
Yeah. So this is pretty much everybody that comes to see me is like, I've seen like 20 other people. We don't have an answer. Like, that's the type of patients I get kind of at the end of their line with talking with other clinicians. But you really look for those things as far as, history of exposure. Again, we talk a lot in depth about childhood. Where did you grow up? Like, what are your family history like? Those types of things. As far as the other testing we do, there are some additional inflammatory markers, immune cell function that I really look at. And you paint this picture and argue kind of like a court case, like, yes, this looks to be suspicious, especially if testing is not great. And are you willing to consider some herbal therapy, or what can we try to see if there is a positive response? Now, with that said, all these things you're referencing as far as like mood dysfunction or gut issues or hormonal imbalance, I mean, we live in a world that's kind of set us up to be very immune disruptive. And that's where I think that a lot of this is coming in. And when we talk about the circadian piece of that, I think that's one of the primary drivers where we have a lot of disruption from our like foundational biology. And that's a problem because that can cause all of this to flare. So I think focusing on those foundational health pieces is, what I have people consider doing initially, because it takes 3 to 4 months to come in and establish with me as a patient. So that I want to give them something to do in that interim to say like, okay, well, let's focus on your nutrition. Let's focus on managing stress. One thing I'll mention, because this is kind of a mom's focus podcast, is that any sudden change in behavior in a child, I'm going to always suspect like PANS or PANDAS, which is it's a neuropsychiatric presentation, either from some sort of pathogen or strep is a big one, where it's like you flip a switch and this kid is like not my kid anymore. There's a physician, pediatrician out in Connecticut I mentor with, and she said, until I'm proven otherwise, those types of presentation in children, that's always an infectious source. And I'm going to try to treat that as best I can.
And you're talking about like my kids switched and now for a few days, they're not seeming like who they are is it like, because kids all the time they seem a little bit bipolar where they're like happy and then they are screaming about the cup and then they're back to, hi mom, I love you.
So this would be like a prolonged, my kid is different and they have never been the same since this event. It's not like, didn't get to read 3 books before bed and I'm upset. That's different. Yep. But this would be a very challenging behavioral change in a child. And the most common thing that I've seen in my patients as far as children is going to be handwriting deterioration or a sudden change in their academic performance. If you're all of a sudden getting like calls from parents at school, like, your kid is not paying attention. They're, and this is very atypical as far as like, they're on task and doing well. I mean, I've seen this so many times, and you could have other triggers for that in addition to Lyme and mycotoxins and such things. But again, it kind of comes down to supporting that kid foundationally as well as what we would do for just about anybody. So.
Wow. I'm really looking forward to the next episode because I have so many questions.
See, I said I can talk about this forever.
I love it.
We could definitely do full hour episodes, but we're going to try and keep it to the kind of the highest points of what the common FAQs are.
Yeah.
But here is another one is you're talking about how symptoms can be not necessarily the bullseye. It could be somebody got bit a year ago and now they're starting to feel joint pain and some symptoms and things like that. What is the urgency level for starting treatment?
Mm-hmm. It's always sooner the better. So if we have, especially children that come in with like this concern or call, I say, if you can get in with your pediatrician, say you're establishing with us and get a prescription started, that would be ideal. I've found there are certain providers that are much more open to that and willing to consider prescribing a little bit early. But again, I tailor my treatment to what patients and their families are looking for. So somebody doesn't want antibiotics, somebody does. I'll respect that as much as possible. But sometimes the issue of leaving an infection untreated is a bigger problem. So really, yes, the sooner the better. But I never want to instill panic. There's always something you can do from a foundational perspective, which is, I think, the hardest thing sometimes to do.
And we will dive more into treatment in our next episode. But just to kind of round this one out, one other common thing that I think parents worry about is they go out in the woods, they get home, 2 hours later, they find a tick on their kid and it's already kind of bit in. So is the length of time that a tick is established to the host or the child or the parent, whoever it is, does that dictate the risk of disease?
I wish I could say yes, but we've seen transmissibility happen within a few minutes because there are already proteins in that saliva of that tick before it even bites. So it has an anesthetizing agent so you don't feel it. So they're very tricksy in that sense. So yes and no. The longer it is attached, I do think there is a little more likelihood of further transmission, but there is a potential that certain things can be transmitted a lot quicker than that. There are certainly things that we suggest. I know we're going to talk about the homeopathics, but there's some preventive options in that kit that we have, topical things. And of course, not every tick transmit Lymes. On our website, we do have the 2 or 3 testing centers that you could save it. So that's the other option. It's not perfect, but it gives us the best chance to really be confident, hey, this doesn't have the serious pathogens we need to be worried about. So save it in a wet towel in a Ziploc bag. I usually double bag mine just because I don't want them coming out.
Yeah.
And then you can send that in for testing. So the number of patients that don't keep them,
Interesting.
It's very, very high. They're like, oh, I just threw it out and flushed it down the toilet or burned it. Or
that's what we used to do
Yeah.
too. We grew up north and
No, I feel like
galore.
that's a great resource is because a parent, a tick is on the child, where you can see that it's actually bit in and the parent is like, do I freak out or not? Well, that's a great option is you can just send the tick in.
Yep. And there's several options that will look at different, depending on cost, of course, you can select what you want to test for, which is helpful. But nothing is perfect, and watch the kiddo and just, if they're doing well,
when could you kind of tick off in your head, oh, I think we're safe?
I would assume safety, honestly.
Okay.
We have so many people that have had this almost recurrence of symptoms just from the anxiety and the worry of this anticipation of oh, this is going to come back. And, you have to keep that nervous system kind of calm and regulated and just, these things happen. I want people to be outside. I don't want there to be this fear of going outdoors, but there are things you can do to treat clothing. There's things, there's absolutely prevention measures that you can take. But, we've had several patients even recently that are in their 70s that are testing positive, and their tick bite was 30 years ago. They could have had another one that was more recent, but sometimes, I don't know. I've never seen the back of my head. Things happen. Yeah. So, yeah.
Wow. This was a great first episode. And I love that perspective. Thank you for sharing that you should assume safety and not instilling the fear. Yeah, that's so key. So like we mentioned a couple times, because I know y'all are sitting on the edge of your seats, if you're listening to this right after it comes out, you got to wait a couple days, but our next episode is going to be all about the treatment and prevention of Lyme. But before we head off of this one, let's talk a little bit about you, Evey.
Yeah.
You are very active on Instagram. So tell us about what people are going to learn if they go to your Instagram page, and then what's your handle?
Oh gosh. So the Fusion FNP, and actually I changed this a few months ago or maybe it was fall, I don't remember, from the functional FNP, just because I was getting a little disenchanted with the functional world as it is, being kind of we're trading medications for supplements, and we utilize those things, but the number of patients I get in with thousands of dollars worth of testing and nobody's really utilized it or actioned on it bothered me. So I really changed it to this fusion, which implies a harmonious integration, this creative process that combines different elements into something new, which really affects how I practice and care for my patients. I believe in blending all these various modalities, perspectives, individual needs to create personalized paths to wellness, and really choosing treatments based on what truly works for each individual. So as far as what I post a lot on Instagram, coming up in May will be a lot about Lyme. But more often it's what I'm doing, my foundational, what do I do every morning? Circadian health, biology, light story. We do a lot of homeopathic, education on there, but it's just general wellness. What can I offer that's not, because I can't see everyone and not everybody wants to see me, and that's totally cool. But if that would be beneficial in that way, that's just my way to kind of connect with the community in that sense. Mm-hmm.
And then if somebody is listening to this and says, I need to talk to her, we're having symptoms in our house, what's the best way to get a hold of you?
Sure. So I would call our office. I don't know if you'll link the number, or email, which is all listed on our website, and request paperwork, because my practice manager does screen everyone and just make sure it's appropriate. We have often, not often, but enough where we will say, this is not quite what we think we can help with. And we're very transparent and honest about that.
Okay. And what is your website?
www.gmofwi.com. greenmedicine.com.
Okay, and that stands for Green Medicine of Wisconsin.
Yes.
Okay, great. This was an awesome first episode. We can't wait to come back with the next one. And then after our next episode, which is going to be about Lyme still, we will be talking about a couple of those things that Evey alluded to. The circadian rhythms is going to be an entire episode in itself. That is for everybody to listen to. And then our last one is going to be about homeopathy and the different ways that you can use it in your own home. These are going to be 4 amazing episodes, so stay tuned for the next one coming up next. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.